Hello all, it is Dr. Alsop here, and I am here to talk about the specific structures in the foot and the ankle that you will need to be able to identify for the practical. So let's start with my favorite, which is of course osteology, and we're going to talk about two of the more clinically important arches and what bones make up these arches. So we're going to start with the medial longitudinal arch. This is the one that is going to be significantly higher than the lateral longitudinal arch in regards to the height of the arch. And so let's talk about the bones that are going to make up these. We are looking at a plantar view of the articulated bones. This is going to be medial. This is going to be lateral. And we know this is medial because this is the first digit. You can tell that we're looking at the big toe or the great toe for a few reasons. The bones are kind of thicker, a little bit stubbier in terms of this region. Also, we do not have an intermediate phalange, so that's a good indication that we are looking at the first digit. So this makes this the fifth. So that always helps me in terms of getting an idea of some of the tarsal bones. You can see the large calcaneus, and you can see this a little bit clearer because we're looking at a view of the sole or the plantar surface. You can see a little bit of the talus here. And it's going to involve all the tarsal bones except for the cuboid. So this is your cuboid here. It's always going to be more lateral, but it will include calcaneus, the talus, the navicular, and all the cuneiforms, in addition to the first three metatarsals. And we know the first three, that will include the first or your big toe, and then this would be 2 and this would be 3. So those are the bones that make up the medial longitudinal arch. When we're talking about the transverse arch, this is going to be formed by the cuboid, which is going to be, remember, on the more lateral side, and all three cuneiforms. So you can see the cuneiforms here, here, and here. You don't have to ID between the different ones there, but just be aware that those are cuneiforms. And then it will include the bases of all 5 metatarsals. So that's forming this transverse arch, and as its name would suggest, it's going to be more transverse than the longitudinal arches. Alright, we have discussed this in a previous video, but we do want to have a nice review of the spring ligament, which you can see here shaded in kind of this nice bright orange. It is going to be particularly important in terms of supporting the head of the talus or the talus and help maintain those arches that we just talked about. So you will hear the spring ligament come up with some form of frequency in terms of clinical MSK medicine. It's going to bridge the gap between the sustentaculum tali of the calcaneus, and you can see the calcaneus here pretty clearly, and then it will insert or have its other attachment to the navicular, which is not quite as clear here because you do have some tendons in this region that are occluding that. But that's going to be your spring ligament. In review from the other sessions, this will be your long plantar, and this, you can see a little bit right there in terms of that shading in blue, is your short plantar ligament. Alright, moving on. So we added on quite a few layers at this point. Basically, we're still looking at a plantar surface of the foot, a plantar view of the foot, excuse me, and all that's been removed in this particular dissection is the skin. So this is just deep to the skin, and you can see that you can barely see any muscles, and that is because the plantar fascia of the plantar surface of the foot is very thick, very robust, and in particular, the most robust portion of that plantar fascia is the central portion, which is often called the plantar aponeurosis. Sometimes people just call this central portion the plantar fascia, but there's plantar fascia throughout. It's specifically the central part is the plantar aponeurosis. It's going to arise posteriorly at the calcaneus, and it's going to continue distally until it divides into these 5 bands that are going to head eventually to the digits. So that's the plantar aponeurosis, and you can see when you're looking at this view just how well protected this plantar surface is, and that makes a lot of sense with all the contact that the sole of the foot will have with the environment. Now, if you remove the plantar fascia and the plantar aponeurosis, then you start getting down to the muscle region. And while we're not having you ID any of the specific muscles in the plantar foot, we do want you to be aware of some of the arterial supply. And so when we're talking about the plantar foot, the main supply is going to be from the medial and lateral plantar arteries. You will have some supply from the deep plantar artery, which you're not going to be able to see in this particular dissection. And we'll talk a little bit more about what that is in a moment, but let's focus on these two first. So at around the calcaneus, the posterior tibial artery is going to split into the medial and the lateral plantar arteries. So if you're trying to figure out, I can see an artery here, kind of turning into a little bit of an arch, and I can see an artery over here. So I need to figure out which one's medial and which one's lateral. And so think about it. I can see a first digit here, because this is your big toe or your great toe. Is your first digit on the foot medial or lateral? It's going to be medial. So this is medial. And here's your fifth digit. This will be lateral. So little things like that will help in terms of understanding, well, if I see an artery here and I see an artery here, which one's medial? Well, it's going to be this one, and this one will be more lateral. The medial plantar artery is usually the smaller of the two in terms of diameter. I would say on this particular donor, the medial plantar artery is a little bit on the larger side than what you typically see. And you can see that it's starting to form a little superficial plantar arch. This is not that plantar arterial arch that's a little bit deeper. Not all individuals will have such a clear arch, but you do see this on this particular individual. The lateral plantar artery is going to form the majority of the plantar arterial arch, which is deep. We would have to remove some of the muscle to get to that particular arch. It will also get supply from the deep plantar artery, which is going to be a continuation of the dorsalis pedis from the dorsal side of the foot. But just to review in terms of being able to identify the arteries at about this level of dissection, the medial plantar artery is going to be here. The lateral will be on the lateral side, and it dives deep or kind of deeper than this particular portion of this muscle to form that plantar arterial arch. Okay, now we are looking at the dorsal side of the foot, so a dorsal view, kind of looking superiorly down onto the top of the foot. And what you can see here is your dorsalis pedis artery, right here. And this is going to be a continuation of the anterior tibial artery. That name transition occurs around the level of the ankle. It typically is in close association with the deep fibular nerve, and it's going to supply these muscles that are associated with the dorsal foot, which have been removed. You can see a little bit of it right here. This will eventually transition into the deep plantar artery, which you can kind of see heading in this region. And this is going to dive, the deep plantar artery specifically, will dive between the first and second digits to contribute to that plantar arterial arch with the lateral plantar artery. And so that would be visible with a very deep dissection of the plantar foot. Okay, now talking a little bit about some of the structures that you can see around the medial and the lateral malleolus. We are going to start with the medial malleolus, and let's see if we can find that here. So here is the heel. You can see the calcaneal tendon right here, so that gives you an indication if you see the calcaneal tendon's been cut, so that means the soleus and the gastrocnemius have been reviewed, so we're looking at the deep compartment of the posterior leg. Over here is going to be the lateral malleolus, and over here will be the medial malleolus. And I can see there's going to be a more significant arch right here, which indicates that we're looking at a medial view. And so you're going to have quite a few structures that are going to enter towards the sole of the foot or the plantar surface of the foot behind or posterior to the medial malleolus. And two that we want to note in this particular dissection are going to be the posterior tibial artery, which you can see here, and the tibial nerve, which you can see here. So the posterior tibial artery is one of the divisions of the popliteal artery. It's going to continue down the posterior leg. It will supply both the superficial and the deep groups of the posterior leg, and then it will go behind the medial malleolus here in order to enter the plantar region of the foot and divide into that medial and lateral plantar arteries that we just saw. The tibial nerve, we know, is going to be one of the terminal branches of the sciatic nerve, and it is supplying this posterior portion of the leg as well, and will also enter towards the sole of the foot behind or posterior to the medial malleolus. In terms of the lateral malleolus, we really are focusing more on the tendons that are going behind or posterior. So you can see the lateral malleolus right here. You can see the fifth digit right here, so we know we're looking at a lateral view. Just in terms of the muscles as a review, this is the gastrocnemius. This is going to be the soleus. So that's that superficial compartment of the posterior leg. And then over here we're getting into that lateral compartment. And I always can tell the fibularis longus tendon because the tendon is longer. It becomes more rope-like. So this is the fibularis longus. And you can see it kind of heading into this region. It'll actually go and kind of travel through on the bottom of the sole of the foot. Whereas the fibularis brevis tendon is going to insert or have its distal attachment on the fifth metatarsal. So it kind of stops right about here-ish. So it'll be the tendons of this lateral compartment of the leg that are going to be traveling behind the lateral malleolus. So those are the main structures that we are going to have you know for the practical in terms of the foot, as well as around the ankle, specifically the malleoli. There's obviously considerably more muscles, particularly intrinsic muscles of the foot, but we've given you a review of the things that you will need to know or be able to identify come practical time. All right, so please do reach out if you have any questions, and I hope that you have a wonderful rest of your day.